I grabbed a few articles here to read and to go over. The first of them recently showed up from Stanford, and people are looking at these things. All right. I keep on saying this, and this is my practice. Right? The way that we're evolving, okay, is that we have the capacity and ability to alter that which we are perceiving. What do I mean by that? Okay, let's say I cut my finger. I can put a topical medication on that. I can put some topical lidocaine. What that does is that numbs that decreases the impulses coming from the periphery to my body, to the processing centers of my body, whether that's my intestine, my heart, my brain, my mind. Okay, so we can alter the signals that are coming in. All right, step number one. Step number two is what we can work on, and this is hugely important. What we can work on is how the sensory organs are interpreting the information and processing it. Okay? So, if I can alter the sensory information that's getting to the sensory organs, let's call the sensory organs my brain, my heart, and my intestines, then the sensory organs are obviously going to perceive the sensations differently. All right, and this might be from everything from pain to electromagnetic, waves to feeling somebody's energy as you're approaching them in a room, whatever it might be. All right, so I have ability of transmitting that information, but then I have the ability of processing that information. And whenever we talk about even the use of mindfulness or meditation or multidisciplinary, multimodal approaches to alterations in sensations, emotions, is that we are working at the level of the input of information, and then we're working at the level of the interpretation of the information. And what these practices do, okay, these practices not only can shift the way that the information comes in, but most importantly is that with repetition, these practices actually start shifting the way that our minds, hearts, and whole bodies are actually interpreting the sensory input that's coming in. We're able to interpret it differently. Okay, if I took one of your brains and was able to remove part of it and replace it with another part that processed information different, you would have a different experience. Now, I can't do that. We are looking at things like Neuralink and stuff like that, little electrical impulses to the brain to change the way that the brains are being connected and stuff like that. But right now, we don't have that ability. We do in terms of, performing a lobotomy. That's going to change the way you're perceiving the information and also the way that you're interpreting the information. All right. With these practices, we are actually literally, it's as if with repetition, right? Which is why we talked about the rip-rap, repetitive intentional practice with a repetitive attentional practice. With repetition, we're actually changing the way that our brains, hearts, bodies are interpreting the information and processing that information, because we're causing different connections between systems in the body. All right. This is when I say, this is some of the most profound neurosurgery you're ever going to perform on yourself, because it's actually altering the connections inside your body without having to do any sort of invasive interventions, except for possibly a practice that may bring you sensations of bliss, joy, and love. And why do I say that? Because we'll go over some of the research on hypnosis here. All right. Now, have I used hypnosis? I absolutely have used hypnosis. I love it. Okay. It's actually recommended by, hypnosis, hypnotherapy in conjunction with things like biofeedback and cognitive behavioral therapy is recommended by the official disability guidelines for workers' compensation. It's recommended as a treatment for chronic pain by the ACOM, the American College of Occupational Environmental Medicine. So this is not stuff that we are, on the fringe. This is recognized by, hardcore guidelines that try to help direct care and try to approve care in a workers' compensation world. Okay, my patient's suffering from chronic pain. They've had medications. They've gone through physical therapy. They're still having pain. We'd like to request some biofeedback, hypnotherapy, and cognitive behavioral therapy. Okay, insurances now are paying for it. From Stanford, all right, I put the link. How hypnosis can alter the brain's perception of pain. This was published in April 14th, 2023. There's a researcher there, David Spiegel. He is an MD. He's one of the leading experts in clinical hypnosis. And he states, as I agree as well, that it should be a first, not last resort. Okay. What happens, right, and as a provider, okay, is that we kind of go through this path of, you have shoulder pain. Well, let me recommend an orthopedic surgeon, right? Because they take care of joints. And so then you go to the orthopedic surgeon and maybe they'll get an MRI. They send you to physical therapy. You're not getting better. They'll offer you an injection. You're not getting better. And then you go to surgery. Now you've had a repair. Now, if the surgery is indicated, if you have a massive rotator cuff tear and you can't move your arm, sure. But if it's just for pain, don't know. Okay. What he states in this article is essentially it should be a first resort, not a last. And what happens is that we think about these things when we've quote unquote exhausted everything else. Well, what's everything else? Right? So in my view, and what we're trying to push to the insurance company is actually these multidisciplinary programs that we offer should actually be first line. It should be first line treatment. Hypnosis, sometimes called hypnotherapy, may be far from mainstream, and some dismiss it as medically unfounded. But Spiegel, professor and associate chair of psychiatry and behavioral sciences, has published decades of research investigating its influence on both brain activity as well as its effectiveness in controlling pain related to surgery, cancer, and fibromyalgia. His latest study found that there are genetic underpinnings to why some people are more hypnotizable than others. He has also developed and narrated a self-hypnosis app geared towards helping people reduce stress, treat insomnia, and even quit smoking. How do you define hypnosis in a medical sense? Hypnosis is just a state of highly focused attention, like getting so caught up in a good movie that you forget you're watching a movie. You enter an imagined world. So you're not purely perceiving, you're experiencing sensation and emotions in a way that allows you potentially to modulate what you're experiencing. For instance, one might imagining they're floating away from the physical sensations of their anxiety. How does hypnosis work for pain treatment? Pain is not simply a peripheral sensation. It's also how the brain interprets and manages that sensation. Okay, that's the key. Right? It's not just here's this nerve that's damaged that's coming to my spinal cord and going up into my brain, but it's got to interpret that signal. Right? And we can do a heck of a lot with our brains to modify our levels of discomfort. We can do a heck. That's in the article. That's not my language, okay? We can do a heck of a lot with our brains to modify our levels of discomfort. Hypnosis allows you to alter perception, to narrow the focus of attention. It also allows you to detach yourself from concerns that might amplify the pain. Interesting, right? We've talked about some of these areas in the brain before. Okay, self-referential areas, areas of self-reflection. Okay, using functional MRI, we found that during hypnosis, a part of the brain called the salience network is less active. This includes the anterior cingulate cortex, the part of the brain that fires off if, for example, you hear a noise you think could be a gunshot. Right? How crazy is this, right? We talked about this in the past. Worst case scenario, right? You're sleeping and all of a sudden you hear, breaking glass, right? What are you going to do? that part of the brain, that alerts you, and there's a stress, fear response that is triggered from that, right? It goes on to say, cancer patients experience a new pain and they think, oh my God, the cancer is spreading, even if it's not. By turning down activity in the salience network through hypnosis, they're less likely to trigger the alarm buttons. Right? How many times when you feel pain, we've talked about this, there's the sensation of pain, but then there's the interpretation of that pain as an alarm. Warning, danger, danger. Right? If every time you felt pain, the fire alarm went off in your head, well, that's fairly distressing. Is it the pain or the fire alarm that's causing more suffering? Oftentimes, it's actually the fire alarm that causes more suffering and that leads to more emotional and psychological distress. And so if we can learn, right, and we do this in meditation as well, if we can learn to uncouple, right, because it's coupled, right, we use sensory input comes in, it's coupled with fear response, right? Sound comes in, here's, sounds like a gunshot, somebody's entering my home with a gun. Well, is that true, or was it just something something else that happened? Okay. Do I have to trigger the fire alarm? Okay. So, if using hypnosis, we can turn down the activity in the salience network, then we're less likely to trigger that alarm. For example, a cancer patient may be taught to imagine floating comfortably in a warm bath, applying a warm compress to the pain. Or they can think of other imagery to filter the hurt out of the pain. While acknowledging that the pain is there, very important, right? We're not resisting it. We're acknowledging it. It's there. My pain is there, right? We're not saying it's not there. They can create distance between themselves and the discomfort of the sensations. They can create distance, right? That's an interesting language, because I use the word uncouple. Oftentimes what happens is that sensations are coupled with emotions, felt senses. Thoughts are coupled with emotions. Thoughts can also be coupled to sensations. What a good hypnotherapist can do is it can make us go into those thoughts or sensations or emotions or whatever it is that are coupled and actually work on uncoupling them. And essentially, what do I mean by coupled is essentially when you feel the sensation is coupled with a thought. So when you feel the sensation, the thought is automatically triggered. And that comes through learning. That comes through previous experience. So in the neuroscience realm, they say, neurons that fire together wire together. So when the sensation neuron and the thought neuron fire together and they have that same thought, now you've just wired that pathway together. What we want to do is try to uncouple that and recognize that's the sensation. Where's this thought coming from? Oftentimes it feels like it's one in the same because they're so fast. Boom. Sensation, thought. There's such a small distance between them that they feel as if they are one in the same, but they're not. And so hypnosis can do this. Mindfulness can do this. Meditation can do this, especially if it's something specifically that we're working on, like this uncoupling. They use the word here, create distance, some sort of distance between themselves and the discomfort, or the sensation and the aftermath of the sensation. Okay. That's just the beginning. We'll go more into hypnosis. There's a really good article on hypnotic approaches for chronic pain management and looking at different areas of the brain. But essentially, the more that we get into this, the more that we open up our toolbox to allow these things to come in, I'm guaranteeing you, this not only works at the level of sensations coming in, but what it works on is the way that our sensory organs are perceiving the information and interpreting it. Okay? And that can be a game changer. That can be a game changer, especially when we know that that this work is doing that. All right. Now, is it going to be immediate? Some effects are immediate. Some effects take time. Right? It's almost like you are training a child how to walk. It's going to take time. The new neurons need to be reconnected. They may need to be unconnected and reconnected to a different area. New dendrites need to be sent off, and new connections between different areas of the brain need to be strengthened or lessened. If we start to learn how to quiet certain areas, right? We start to learn how to quiet certain areas, then they're not going to be as readily active. We're actually learning how to guide them. Right? And this, ladies and gentlemen, is attention. It's really about, the old adage, where attention goes, energy flows. Where attention goes, energy flows. And that's just the question that you want to keep on asking yourself. Where do I want my attention to go? Such that energy flows in that direction. When energy flows, now neurons start going in that direction. You're starting to train your body, your mind, your heart, your gut, your spirit. Physiologically, very powerful. Okay? So with that, let's go into our practice. Okay, so finding a comfortable posture. A posture you feel relaxed, yet alert. Closing your eyes if you feel comfortable closing your eyes. If not, having a soft downward gaze as you're looking off on the horizon. And taking a few deep breaths, allowing yourself to be in the present moment as much as you can. And with each in-breath, bringing in the breath and sending it to any area of your body that you feel could use a little bit more oxygen. And with each exhale, releasing any tension that you feel you can release through your breath. Even if there's just a slight intention. And then choosing a place to direct your attention to. It could be on a certain object, like your breath, a word, a phrase, a prayer, a felt sense in the body. But this is a place you choose. It could even be an imaginary shape, an imaginary place. But you choose it. You could even choose to rest your attention. Resting your attention and not directing it outward in any particular way. But seeing if you can rest your attention back in its source. In pure awareness. And just noticing how quickly your mind tries to grab your attention and move it to something else. Just be curious about that. Notice how long you can sustain your attention on something you choose. or how long you can rest in awareness before your attention is grabbed and pulled along. As soon as you notice that, you can have a little half smile on your face, almost like you're recognizing the play of the mind, almost like you're smiling at the mind itself. My attention just drifted. And as soon as you recognize that, you can come back. There's no judgment. And if there is, we recognize that as well. And we come back. There's no right or wrong. There's no good or bad. Using the mind to watch the mind. Using the mind to watch the playfulness of the mind. And just noticing where your attention is now. Noticing what your present moment experiences as a felt sense throughout your whole body. And as we bring this meditation to a close today, just noticing, witnessing how you were able to pay attention, how you were able to direct your attention, even if just for a second, and how that was for you. And taking 2 or 3 deep breaths, feeling your feet on the floor, whatever surface they're on, your thighs and back, your arms, your whole body. Opening your eyes if your eyes were closed. And just taking a moment to reflect on your practice.